Everyone, we're Healthcare for All Oregon, and today we're going to be doing the Hear Me Out cake trend.
Hear me out, a universal healthcare system without any copays or deductibles. Imagine a system where you leave your provider, you leave the emergency room, you leave the dentist, and you know that you've already paid for everything.
Hear Me Out, a system that allows providers to focus solely on care. Right now, profit is in the mind of a lot of people because that's the way our system is set up. So if we could change our system, this could be a priority.
Hear me out. Here in Oregon, we could save about $1 billion a year. The Joint Task Force on Universal Healthcare released a report in 2022 and estimates that we could spend about $980 million less per year switching to universal healthcare, which is a savings of about $1 billion every year.
Hear Me Out, a system that is easier for small business owners. Currently, small business owners have to spend so much time and energy and money on providing healthcare for their employees, and with a single payer system, all of that would be gone.
Oh yeah. Dental and mental health care being included in your system. Instead of having your luxury bones that you have to worry about differently than the rest of your body, instead of your eyes and your mental health being like something separate from the rest of you, they'll be all included in the same system.
Hear Me Out, a healthcare system that prioritizes care over profit. Now, we've talked about this a little already, but current system doesn't do the best job at that, and a system like this would really make sure that everybody is getting access and it's equitable.
Hear me out. We would be joining the whole rest of the world, or at least most of the rest of the world. Dozens and dozens of countries already have a universal healthcare system. For example, Canada started with just Saskatchewan, same as how Oregon could be the first state to transition out of our 50 states. Anyway, we'd be joining the rest of the world that has already decided that this is a priority for the people that live there.
Hear Me Out, not having the most expensive healthcare system in the whole world.
Would you believe it? I also had the same Hear Me Out.
Oh, no way.
Not having the most expensive healthcare in the world. Our spending in the U.S. in 2022 averaged $12,000 per person. The next most expensive country, Switzerland, is $8,000 per person. Comparable countries, like with the same GDP-ish as the US, are spending about half what we are spending annually. We have the most expensive system currently that exists.
Hear Me Out, a system where providers are fairly compensated. This way our providers can feel truly valued for the important work they do, and again, care can be prioritized over profit.
Hear me out. You might be thinking, there's no way that we can do this. Well, we are doing it as a state. We have our Universal Health Plan Governance Board, which was appointed by our governor and kind of housed in Salem's Department of Consumer and Business Services. And they have a job to deliver a transition plan for our whole state. And they're required to deliver that transition plan in just about 2 years in September 2026. So we are actually doing this.
Hear Me Out, a simplified, equitable, and affordable healthcare system that would be accessible to all Oregonians.
Seems like you might have a lot of concerns about this. Well, hear us out. You've got plenty of time to talk to the governance board about it. They have monthly meetings from now until September 2026. And if you are concerned about this potential transition to a system that will provide us all better care and save us money, there's concerns, I get it. There's plenty of time to talk to them. Give your testimony to the governance board or to the different committees that are working with them to make this reality. Thanks for hearing us out. We're gonna eat some cake now.
Yeah.
You made this, right?
Mm-hmm.
Cool. Great cook.
Completely homemade.
Later.
Thanks, everyone.